Hello, everyone, and welcome to the Neuroplasticity Alliance's Therapy Innovation Summit 2022. I'm your host, Sherry Odom, and I'm really excited today to introduce you to Mark Watson, who is the CEO and co-founder of ABI Wellness. It's a brain injury recovery and enhancement program, and they have developed a unique neuroplastic protocol that leverages cognitive and cardiovascular exercises, mindfulness, nerve stimulation, and tracking to accomplish some phenomenal results. They've got a return to work rate of over 70%, and that's really amazing when you compare it to the 40% return to work rate for traditional programs. Mark, thank you so much for joining us today. I'm super excited to hear your story since we've spoken last, and welcome.
Oh, thanks for having me. Super excited to share some of the work and in conjunction with some of the other great speakers here that are all going to be talking about improving lives through neuroplasticity.
Yeah, well, it's we do have a great list of speakers, but I have to tell you, you're probably one of my favorite ones to have on here because of your inspiring story. You really have just done some amazing work there, and maybe that's a good place to start. Can you just share a little bit more of your background and what inspired you to create ABI Wellness and the Bears program?
For sure, I'd be happy to. I think one of my mentors is also another featured speaker here. Barbara Aerosmith-Young is a remarkable human doing really important work. My background kind of in working in more what we might call special populations is it comes down to me being diagnosed with dyslexia very early on in life, which is a language-based learning disability, to having some challenges in school early on, to starting to finally understand how I learn and how I may learn best, to finding an island of competence, as Dr. Bob Brooks would suggest out of Harvard, which happened to be athletics for me, and ended up being football, and then experiencing concussion, and then understanding that unlike what we see in a lot of physical rehab, a lot of more of the cognitive rehab was not as active as it could be, given that, as the topic of this whole conference is, the brain can change, both positively and unfortunately negatively. But that is the nature of neuroplasticity, is that the brain can change. It has remarkable capacity to change throughout a lifetime. So once I started to learn about that and had Barbara Aerosmith-Young, a mentor, but also Howard Eden, another mentor in the education sector, I had the opportunity to start to better understand applied neuroplasticity in more of an educational setting. And then over time, started to work more in sort of the brain injury world, because we were experiencing what seemed to be very good cognitive benefit or cognitive change for people with brain injury that came into our schools that were designed for people with learning disabilities. We started to understand, oh my goodness, there's a big unmet need here to try to help people with brain injury in our communities to get access to options that would help them to change their own brains for the better.
Yeah, that's amazing. So many of the people engaged in this space really have a personal story, and it's motivated them and moved them to do, some amazing things. You're talking about applied neuroplasticity. Maybe that's a good spot to kind of jump off into what the Bears program actually looks like. What would somebody going through that program experience? How long does it take? What does the day-to-day exercises look like? And how does that vary based on the challenges that each person is facing?
Yes, I mean, what I really enjoy about the Bears program, and of course I'm biased, is that the Bears program is individualized based on the needs of that individual. So initially with the Bears program, we were really focused on what we would call the complex mild TBI population. And that means people that are typically kind of struggling post-concussion, okay? So, but what we come to learn is people with severe TBI also need programs. People that are struggling with the long-term effects of COVID now need cognitive programs. People who have had an anoxic drug overdose need programs. People who are going through cancer chemotherapy and experience brain fog, they need programs. So typically what these individuals would go through would be they would work with a cognitive kind of coach that would assess them and then provide them with access to an individualized program, either virtually like we are doing here through Zoom, or in a healthcare clinic. And then they would engage in aerobic exercise for cognitive benefit. They would engage in this kind of neuroplastic cognitive enhancement work that Barbara designed. They would also engage in mindfulness meditation. And then we would also look at integrated health tracking and quality of life, because one of the areas that people really struggle with understanding when we're looking at any sort of neuroplastic work is, how does that work you're doing actually transfer into the everyday activities for that individual?
Yeah, and so you're able to measure the progress as they go through. And Mark, how does the treatment differ between somebody who's got a mild cognitive challenge or somebody who's been through a more difficult process? How does that look, and how do you decide where to start the treatment program?
Well, the beauty of that is with ABI Wellness, what we do is we work with professionals that already specialize in this space. So these could be physiotherapists, this could be occupational therapists, this could be chiropractors. They already know what their client will need. What we do is we provide the platform and the assessment that aligns with the rehabilitation. So if somebody has, let's say, a more of a mild cognitive challenge, then their program is probably going to be a little bit more mild based on the goals they have for their rehab, the time that they have available for the rehab, and the symptoms. So typically that might mean more like 4 hours per week that they're engaged in at their own schedule. For somebody that might have, higher needs at this time or bigger goals, maybe somebody that's had one failed return to work following stroke and has persisting cognitive challenges, it might be more like a 10 to 12 to 14 hours per week, with the goal of like an 80-90% return to work after 3 months. It'll just depend on the needs of that individual. And that's part of what we've designed very intentionally in our platform, is to make it individualized based on the needs of that individual.
Yeah, and that's really where the neuroplasticity is of greater benefit, right? It's got to be very tailored to that individual. You mentioned chemotherapy, treating patients who have gone through that and dealing with that. What about patients with neurodegenerative diseases like Parkinson's or multiple sclerosis?
I think we need there's so much optimism for neuroplasticity in that population. That's less our focus at this time. However, it's always something that we want to look into and to better understand. We've worked a little bit in the PTSD population. We've worked in severe TBI. We've worked in anoxic acquired brain injury. So with MS, we're not sure yet, but we're open to continuing to look at how to serve and support. There's a lot of really interesting programs out there. I think we're going to talk a little bit about PONS maybe down the line here. But there's some hope for the future about some of the neuroplastic based programs in treating other neurodegenerative diseases.
Yeah, that's good to hear, because there's just, when you look at the range of neuroplasticity practitioners that are out there, so few of them are focused on those neurodegenerative diseases. And I think it's an area where there's a lot of opportunity if you look
Definitely.
at the percentage of population across the
I
globe.
mean, if I could, when you talk about sort of my motivation in some of this work, you talk about cancer chemotherapy, as that's part of my journey. And, about, almost a decade ago now, I went through that process. And in going through that process, I came to learn that a lot of the healthcare was on, or perceived to be on, the oncologist and the nurses. But in reality, actually, a lot of the healthcare and the responsibility was actually on the patient. So I came to learn that was definitely the case. And, going forward here, when we think about this work too, what can we do to further empower the patient to be active in their rehab, to further promote healthy healing and healthy outcomes? So, when I was in that chair, which is a lonely place, as many of us know, receiving, chemotherapy, you have time sometimes to think about what you're doing, why you're doing what you're doing, and to reflect. And in those moments, it was a lot of gratitude I felt for everybody doing things to try to help me. And what could I be doing to further help myself? So I walked every day. I started meditating every single day. I journal, which wasn't a thing for me before. And I really tracked my quality of life. So when you go in for many of those sorts of conditions, one of the first things you do is your PHQ, your quality of life. How am I today out of 10? Simple number line, and you draw the line across. Okay, that's very important. You draw that line across. So regardless of what the tumors may be doing, I'm at an 8 out of 10. Well, that's what's really important, right? So when we think about this work in brain health and brain injury, we have to, now that we know what we know, how do we exhaust the opportunity for community-based health promoting activities through allied health professionals to help these people? Because they need it. And not only do they need it, but we can do something about it. So that's where, Sherry, I really love what you're doing here with this conference, because I think you've got some really great people here talking about things that are really providing this term of agency to the individual, but also to the clinician, to help them to help more people. And I think that's such a wonderful thing. And that's a big part of the learning through my personal experience of going through that, where I was like, holy smokes, I'm getting so much good help here. But what about people with these neurodegenerative diseases? What about people with brain injury? What about people with stroke that are in community that once discharged are really struggling to find agency and support and programs and platforms that they can engage in to help them kind of pave their road to recovery?
Yeah, Mark, you're such a bright light, and it's obvious that you've taken your challenges and really talk about pay it forward, right? And that's kind of you're the perfect poster card for that. And I guess taking that from your personal situation is really what's helped you to accomplish such a huge return to work rate, because you've been through it, you understand that, and you've got such a great support team on your mentorship. Can you maybe walk us through some of the science behind how you've accomplished that?
I mean, in any of this work, I think you can have really nice people, and that's important, and good intention, that's also very important. But outcomes really matter. And so I think on the science side, what made the greatest difference was a great team. We had a question, right? Which was, can people with chronic cognitive symptoms improve cognitive function following post-acute recovery? And what that looked like at that time, it's changing all the time. But at that time, it was people, let's say, with a concussion that still struggled with activities of daily living and cognition at the 2-year mark. Okay, at month 25, could they engage in a program that could actually drive cognitive change? That was the big question. And what we found, well, not we, a great team of researchers and clinicians at the Faculty of Medicine at University of British Columbia up here in Canada found was, yes, they could. Absolutely, they could. Neuroplasticity was absolutely possible in this population. And then those data were presented at the World Congress on Brain Injury in the Netherlands. And that was really the start, because even for us, Howard Eaton, co-founder and mentor of mine, we weren't wanting to start any of this unless we had good data backing it up. So I think that was step one, was, okay, let's see if people will engage. Many people, at other universities, I won't say which universities out of compassion for them, but their question was, well, these people have brain injuries, they're not going to engage. And Sherry, what I did in that, because I thought about my lived experience and many of, not just mine, but many of the other people who would continue to inspire me. How do you know that? Have you tried? if you're sitting in the faculty of medicine where a philanthropist oftentimes paid for that building based on inquiry and the process of science, how do you know that? And I remember in that meeting with some really smart people, and I had definitely had a little bit of that white coat syndrome, sitting across a line of really intelligent people. I think one of them mentioned that many of these people struggle with getting to appointments on time and all of these things. And I said, yeah, exactly, they do, because their cognitive functions are lower. Yes. So we got to try to answer this question to see if they can, because we truly didn't know. We believe that they could, but that's the beauty of science, is let the data speak. Whatever it says, let it speak. And that was the beauty of this project that continues to inspire me every single day, is had we not had the courage to do that study, I could not speak with the level of agency I do today about this particular topic.
Yeah, so pushing back on the more traditional healthcare programs that are out there is a big need for the neuroplasticity industry. You've made some success through the research and the data generating. Are there other recommendations out there that you can share that might help other providers move this forward? Like, how do we accomplish this?
100%. There's so many things that are accessible here today now. You don't necessarily have to, go to an ABI Wellness provider to get good neuroplastic care. That's just not true. In some cases, it's absolutely true, but it's not true for all. So, a reference that I would like to share is, just moving, okay, in an organized way that is tracked. We all have access to these smartwatches, and your phone's got them. Moving with your heart rate in the zone will promote neuroplasticity. Okay, so it will promote neurogenesis. Okay, so there's a really great book by Dr. John Rady, who's an individual that I've had a chance to spend a little bit of time with. Pick up that book. I'd like to recommend, if you could put that in the notes, Sherry. He's a mentor, and I feel like a friend, that is really one of the kind of seminal impacts on utilizing aerobic exercise to improve attention. So, there's a project he took on with some at-risk youth in Naperville, Illinois, just outside of Chicago. And many of these kids were medicated due to their attention disorders. And Dr. Rady had kind of helped to spearhead a study looking at, okay, what if these kids all exercised before school, and then looked at the outcomes, and the findings were remarkable. So that's number one. Okay, so aerobic exercise, it's a tool that's sitting there for us right now. Look up Dr. Rady's work, because he's done the academic rigor to prove these theories. So thank you, Dr. Rady, wherever you are. You're a mentor of mine, big time. He's somewhere at Harvard doing something, who knows what, but he's a great guy. The other thing is mindfulness. Okay, so engage in a mindful practice. It can help to steady the mind a bit. Okay, steady the brain so the mind can be a little bit more steadied as well. So there's many different ways to practice mindfulness, but one of the things I really have struggled with clinically, as I hear about different clinics that are utilizing mindfulness-based programs, is that oftentimes they're actually not very well developed or measured or scaled. Therefore, they don't tie into habit. That's an issue for me. Living up here in Vancouver, the home of Lululemon, we're supposed to be the most kind of mindful place anywhere, and I think we are. I think we're really good. So don't beat me up, everybody. But I think that turning that into an actual practice can be a little bit challenging. So there's a lot of good applications out there that people can look at. But remember, neuroplasticity is possible for you. So, but neuroplasticity is also neither positive nor negative. It just is. So if you're engaging in those negative habits, undoing some of those negative habits is also really hard. Okay, so that's number two. Number three, okay, is really looking at cognitive training, that sort of thing. So I really like what Barbara's created. I think it's really, really powerful. But there's other ways to do that as well. So there's other programs you can look at depending on what you're struggling with. So I think be careful, like buyer beware on those things, because there's a lot of really cool looking applications out there, but do your homework, look into it, and then ask your doctor, ask NPA. NPA is going to do the work, really looking into good neuroplastic applications. I know you, Sherry, you do your homework. So, those are just a few things that come to mind around neuroplasticity.
Yeah, that's super helpful, because I think as individuals really, struggle, it's difficult. And I've experienced that myself, having to travel, and I'm in the United States, having to travel to Canada to find some of these providers and get access to it. It's not always easy from a time standpoint. And it's hard to sort of evaluate this, especially when you've got people who are out there doubting the value of neuroplasticity and that it works, and they're in your caregiver team. So you have to go out and do the due diligence on your own a little bit. And so I'm glad that you're able to give everybody a couple of, starters to get them down the path and beginning on that process. Let's switch gears a little bit and talk about long COVID. I know that you've got a program there for COVID, and I think this is actually when I first met you during the pandemic, and we were, trying to fill our space and figure out what to do when we couldn't meet in person. What can you tell us a little bit about your research and how you apply the BEARS program to help people who are struggling with the neurological challenges that COVID has left for them?
So absolutely. Again, I'd like to talk about another mentor though first. There's some great people out there always looking to better understand how programs can work, and maybe he's a connection I can make for you. So he's an Aussie, an innovative Aussie physical therapist out of New York, and so he is at Mount Sinai Hospital System in New York City. His name's Dr. David Petruno. And Dave, during the pandemic, they kind of repurposed his lab. So he looks at innovation and technology and rehab, and kind of made it into a staff recharge room. Okay, and then he worked remotely. And what Dave has done with a great group of fellow researchers is started to look at and study long COVID and what is underpinning this condition. And Dave is, again, a mentor of mine, but also a friend. And what he's doing is trying to better understand therapeutically, how do we assess and really how do we move forward with treatment options for this population, because they'll be studying long COVID for a very, very long time. And it's so early that it's hard to understand what to actually do. So what we decided to do was, when we looked at long COVID, we were like already working with many clinics and saying, okay, well, as long as they're safe enough to be able to try to engage in this sort of a program, in our BEARS kind of light program, without the physical activity, because we know that could, in some cases, exacerbate symptoms. Let's look and see how they could engage in this program. And what we're finding, it's early, but what we're finding is in those that can engage are really improving, seemingly, reducing some of their symptoms, which is wonderful to see. And again, a reason for hope for people that are out there right now that are struggling with this, to look at great research done by people like Dr. Petruno, by other really good physical therapists out there, that we still have a lot to learn, but don't give up yet. Okay, please don't give up yet, because there are different ways, and many people are working on this problem, trying to better understand how to help. Because when we look at medical innovations and problems, just one area we can look at is cancer. I mean, many cancers that were diagnosed 15 years ago, had a very poor outcome. But as research kept moving forward, many of those now are close to curable, if not curable. So we have to remember that science is a process, and with COVID, it's still so early. But really, really good innovative organizations are out there working on this problem hard with high degrees of integrity. So, what we're seeing with BEARS is many people struggle with this concept of brain fog, Sherry, right? And we've been talking about brain fog for a long time, way before COVID, because that's, it's something that Barbara has talked about for a very, very long time, as many people have struggled with this, this symptom. Well, what underpins brain fog, right? It's usually, in many cases, cognition or lack of cognition, lack of processing speed, lack of being able to think in real time. well, Sherry, this is what we do. So when we heard this brain fog concept, we're like, well, that sounds like post-concussion. That sounds like people that might be experiencing this brain fog due to cancer chemotherapy. That sounds like people who have been struggling with fluid processing following brain injury. This sounds similar. So then it came to just working with some of the clinics that we serve and work with and saying, okay, maybe if it's safe, why don't we give this a try for this population? And that's where we're starting to really learn and pivot. And I really credit another member of our team, Sean Porter, who's a neuroscientist on our team, who's done, I think, just a wonderful job trying to better understand this and trying to better understand how we may be able to help. So we also wrote a little white paper on it as well.
Yeah. And that's available on your website for people to download?
Correct. It's right there. Yeah. And yeah.
Well, I've taken a look at that. I think it's very helpful. And if somebody out there is trying to figure out what's wrong with them with long COVID and how to treat it, I think it's a good recommendation to read it and explore it and do it. It gives you the tools you need to do a little more research on your own and get knowledgeable about it, if nothing else.
And what I want to say, if you or a loved one is struggling with this, go to your physician, go to your doctor and report your symptoms, okay? Because this is an ever moving field right now. And I think more and more studies are being done and more programs are becoming available. So that's my encouragement to you is don't be quiet about this. Don't just suck it up. That's not the right strategy here. Go and talk to your healthcare professional that you trust, talk to a loved one, and start to get a little bit of help, because people are really working hard on this, especially even on the pulmonary side of it. There's some remarkable things going on there.
Yeah, well, thanks for the encouragement, Mark. I think people need that out there. Switching gears a little bit back to the Bears program, one of the questions I had was on diet. You hear so much about neuroplasticity and your intake of supplements and diet and managing your nutrition. What have you found for the Bears program? How do you incorporate that group of knowledge into your program?
Oh, what a great question. So at some of our clinics, we brought in specialized nutritionists to really look at diet. However, at this point in our platform, it's not something we're measuring, but we're recommending that our clinics, many of our clinics already measure this. So if you're working with someone like, in many cases in the United States, functional neurologists, many of them are doing blood draws and looking at, inflammation. So we know that diet is very important. Movement is very important. But with Bears, we're not steering that or guiding that, because our clinics are typically already looking at that. It's something that we're going to be delving into. It's almost like you're in my mind here, Sherry. It's something that's coming. And that's the thing about diets, and I'm nowhere near certified to be able to talk about that. But I think just be careful about what you're putting in, because that's the fuel that your body needs to get you the output that you're looking for. So, one key thing I will say is hydration. Most of us are way underhydrated. That's why you see me, I'm the joke of my house with a very big water bottle. We've got to make sure that we're working hard to try to keep hydrated. And with diet, nutrition, just remember, that's the fuel. It's the simple one. That's the gas we're putting in the tank here, or the charge we're putting into the car, the kind of electricity that we're using. So, being mindful of what you're taking in, I think, is a good approach. And then maybe in some cases working with a nutritionist to help you to better understand. And many of the healthcare professionals, the clinics we work with, they're all over this. Almost all of them are all over nutrition. So I think just it's important to understand the relationship between diet and overall health and energy. It's very, very important. And it can be hard to admit. That's the other thing, is being honest with ourselves is the key thing. That's something that I struggle with. But I think we all can at times. Really acknowledging what we're eating and trying to understand how it maybe makes us feel. And then going from there. And with many cognitive challenges, many of the cognitive challenges that we're seeing relate to neural inflammation. Well, then we want to think about which foods are we taking in that may be inflammatory in nature, and then really giving that some thought.
Yeah, Dr. Dale Bredesen, his book, I know he's got it geared towards Alzheimer's, but if you look at the science behind what he's doing with nutrition, Terry
Yeah,
Walls is another,
yeah.
David Perlmutter. I mean, I think those are all good resources. And I'm glad to hear that you're incorporating that into your program. It's not surprising, given how aggressive you are on making sure that your patients get the best of all aspects on neuroplasticity.
For sure.
Can we jump back to the research just a little bit? Because I know that you're constantly working on this, and you mentioned Sean on your team, which I've had the pleasure of meeting. What are you working on now to help refine your program? What research do you have in the hopper?
Oh, such a good question. So recently, Barbara and her team, we've all been working on trying to focus on clinical. Was how do we make this more accessible to more people? Because that's been a problem over the years that many people have struggled with. So being able to increase the accessibility through virtual care models has been key, but it's also been very, very important to make sure that it's tested and researched before deployment. So that's been a lot of the primary focus, was how do we make this a bit more accessible in that way? And number two is really helping to better explain what we're doing and testing that with our communications people. Really, how do we blend what evidence is telling us is good into a system that helps one to inform and change their own habits? So, another, great book that I'd like to share is Atomic Habits by James Clear. Many people have read it. It's a great book, but also I'm shocked many people haven't. If you're ever looking to make some sort of a change or optimize your life a bit more, read that book. If we're struggling with our overall brain health, what I think James Clear, and you could correct me if I'm wrong, would say is set up your environment before you start, maybe even the night before, in a way that promotes more optimal brain health activities. And with Bears, what we've done is we've created this system. So we've applied, I'm really proud, we've applied systems theory into the rehabilitation process. Therefore, if one is not utilizing more of a systematized approach and more of a siloed approach, surely what we're doing is going to provide much more value of time and resources utilized for that individual and for that clinician. So I think that's really been the focus. I'm in terms of our research with universities, that sort of stuff, that always we're looking at that. We've looked at the MCI, so mild cognitive impairment population. We've done a study there that was really positive. We worked with March of Dimes on that in stroke as well. We've looked at complex mild TBI. We've done a couple of N of ones in neurological cancer. And it's really coming up as quite very positive. But sadly, that's because the standard of care really needs to shift and change, because the standard of care is not where it will be in 10 years. That's the thing. I'm so excited to see where it's going, because it's going to be very, very, the future is so incredibly bright.
Yeah, I love your message of hope. And I think that's, for neuroplasticity, our providers tend to be sort of a last resource of hope, right? You get to a neuroplastic provider after you've gone through the traditional care. So you've got to have that positive attitude. You got to keep pushing. You got to keep working to try something that will find you, because it's out there, right? It is out there, and you're proof positive that if you just keep pushing, you'll find an answer to it. And speaking of that, the PONS device is something I know that you're working on. This was an electrical stimulation device that was discussed in Norman Deutsch's book.
Mm-hmm.
How's your progress going there?
Well, so it's still early on that one with us. Some of the other providers that we know utilize that device, and it really is, a stimulation device, looking at stimulating the vagus nerve, and really helping with kind of gait balance. And I believe, again, started in working in multiple sclerosis, and it kind of has gone from there. So we've heard of some people that have gone through the program at our providers. I haven't worked directly with it, but some of our providers use them in conjunction. And I've heard really good things about the blend of the two together. And I think it's exciting because a lot of people, same kind of thing, it's about agency. a lot of people who struggle with this gait and balance, and then subsequently the impact on their overall quality of life because their inability to move independently, that's really that's really problematic. And it's great that organizations are working to address that issue, not just Pons, but many out there working on that issue. And it's great to see, because I'm hearing and I'm seeing, some of the results from that. It's massive. It's very, very exciting, because the other thing that we can do really well right now is we can measure gait and balance very reliably, so the outcome measures are strong. And one of the areas where I hear a bit of pushback on that is, well, what if it's just really good physiotherapy in conjunction with the Pons? What if it's just a great physiotherapy, practitioner with the Pons device? Wonderful, great, excellent, good. What's the outcome? Like, that's the bottom line. I think sometimes we get too focused on details, when we really need to be focused on the process and the outcome. And one individual that I've been exposed to and talked with, she's used the Pons device, and it's really made a significant difference in her quality of life and her capacity to move. And she had tried everything before. So I look at that and say, isn't that great? I think it's really important to have the right mindset into this work, obviously with integrity and with the right measures. But I think it's easy. I think it goes back to the Brene Brown stuff. I think it's easy to be on the sideline and to be criticizing certain things, but I choose to listen to more of the people that are in the arena at this point.
Yeah. I love Brene Brown too.
I'm with you. Yeah, she's amazing. She's amazing.
Yeah.
Yeah.
Well, I know that you are super passionate, Mark, about trying to help as many people as you possibly can. And so you've got locations and partnerships in Canada and the US.
Yeah.
What's the best way for people to reach out and find, somebody in your network that can participate and administer the Bears program?
Yeah, just go to our website, www.abiwellness.com. And you go to our providers link, they're all listed there. However, it's growing, so they may not be. You reach out and give us a call. The number's right on the website, or info@abiwellness.com, and we'll get back to you within 24 hours always. And also, if you want to learn more or interested, I encourage you, as you do, I know, take a listen to our podcast. We're constantly featuring really cool leaders out there in this work that are doing really important stuff. If you are somebody that works in this space, we want to make it more accessible, because sadly, one of the areas that motivates me, but also I beat myself up over, is this kind of program is nowhere near as available as it needs to be. I've seen too many families have to be split up because they needed this sort of a program. I've seen people move countries because they need this program, and that needs to change. So if you know of an organization out there that needs this sort of work or wants to look at it, we definitely want to hear from you.
Great. That's the fact that you're expanding so quickly is making a big difference in people's lives. I mean, when we spoke about a year ago, I'm not sure there was but one location in the United States. And how many do you have now in the US?
It's hard to keep track. It's growing, and we're just gonna keep moving.
Total, how many locations?
I think we're in about north of 10, 15 at this point, and we just took on a bigger kind of national program here in Canada as well. So it's just gonna keep going, and the United States is where we want to keep growing. So so many people there, we get so many inquiries from people in the United States, but sadly, it's really not nearly as available in the United States as it needs to be. So if you're hearing this message and you work in this space as a PT, as an OT, as an MD, we definitely want to hear from you.
Yeah. Mark, is the treatment, can you do a combination of in-person and virtual?
Absolutely.
Yeah. With the first visit would be in person, if
doesn't have to be.
Okay.
No, doesn't have to be. We found a full combination, and this is the thing about Bears. I go back to the Atomic Habits, is for some people, they may not be able to engage in the cognitive element just yet because of a number of reasons. But working with a kinesiologist or a physiotherapist on the treadmill, working on gait, balance, and movement related to neuroplasticity or pre-neuroplasticity is wonderful. So some people start there, right? And then slowly engage in. I almost look at it like a fuse box, clicking switches and ultimately getting up to as full of a number of switches on as possible. But sometimes you just got to start with one, and we can do it that way too. And that's been a wonderful, again, teacher for me is some of our clients that have been able to engage at that and then slowly but surely increase from there.
Yeah, I like that analogy. Mark, is there anything else you're working on that you think our audience would enjoy hearing about?
Well, I mean, we're always looking for really inspirational stories. So of brain health. So we've had ultra marathoners who started their running journey at 65. We've had people who have healed some of their brain injuries through unconventional methods. I want to speak with researchers. So I want to hear from anybody in this space that's really passionate about cognition and brain health. If you're in that space, I mean, sometimes people think, when they get an email from me, it's not me, it's me. We're very motivated to get access to different programs out there. If you know of a really good program that's working, wonderful, let us know. Like, we're just totally open. So what we're working on is increasing accessibility for people in need. That is the priority right now, is to really do that. That's number one. Not taking on too many more research projects right now. It's more about how do we get this program available to people in need.
Yeah. Well, Mark, thank you for joining us today. I always leave our conversations so inspired and ready to go tackle the world. So I hope our audience has enjoyed this discussion. Again, please go to the website, abiwellness.com. They've got case studies on there. There's a white paper for long COVID, and you can find a location there as well. Mark, thanks again so much.
Pleasure's mine. Thank you. I love what you're doing. I got your back. I think it's great. Thank you all for showing the interest in MPA and what they're doing. Remember, the brain can change throughout the lifetime. Do not let people tell you otherwise. You just have to take the steps yourself.